If you think you have weak calves, then we have an option for you. This video might help you. I'm Dr. Ashish Davalbhakta, the Medical Director at Aesthetics Medispa and Advanced Aesthetics, and also the lead aesthetic plastic surgeon at My Aesthetic Plus in Navi Mumbai. You may have heard about calf implants. Of course, calf implants is an option, but there are other options for augmenting or building up your calf. If you feel that you have weak calves, you're lacking confidence, you've been gymming, you've been trying to exercise and build up your body, but your calves are not building up, then in such people, calf augmentation with either implants, fat grafting, or both combined, which is called hybrid, are options. Now there are a lot of pros and cons, and which one to use, which one to go for is a lot to be discussed, and I would recommend having a detailed consultation with us in the clinic. But here broadly I'm going to tell you that fat grafting is a process where we suck fat out through liposuction from areas where there is more fat like the abdomen, and then processing it and injecting into the calves. For safety, ISAPS recommends that the fat should be injected in the subcutaneous space where the fat is, and not in the muscle, which some surgeons do, because there's a high risk of embolization. So subcutaneous injection of fat, you can inject it even in those areas where the implant can't go. So that's the advantage of fat, but there are limitations to how much fat can go in and how much fat will survive, and hence often you may need an implant as well. Of course, just doing an implant augmentation on its own can give you a very significant improvement and a satisfying appearance to the calves. I've put single implants if you feel that the medial compartment, medial gastrocnemius is weak. Gastrocnemius is that muscle behind the leg which helps you stand on your toes. So it contracts and it tightens or lifts the ankle up. But those two gastrocnemia, the medial and the lateral, are the ones that we are augmenting. The implant goes in a plane which is under the deep fascia but on top of the muscle. You can put one in the medial compartment and one in the lateral compartment. You can have two implants. If you have a significantly small or hypoplastic calf, then two implants, but sometimes just one is enough. And you have to look at which side is deficient or hypoplastic and go in for that one. There are satisfactory results with the calf implants, or you may feel like bolstering it more and merging or tapering the edges of the implant, and you may want to go in for fat grafting along with it, and that is a procedure which is called as hybrid. You have three options here: going for fat grafting alone, going for implants alone, or going for implants with fat grafting. Now there are more risk if you are doing fat grafting with implants, and in another video we'll cover what is the consequence of doing them together. Is it advisable to do it sequentially, one after the other, and if so, what the sequence should be. So we'll cover that in another video, but this should be enough for this one. I hope you like this video. Please don't forget to click the like button, share it with your friends, and if you have any queries, write to us. We'll be happy to answer.